Welcome to the deep dive. So today we're taking a focused look at some specific information that's come out regarding President Biden's health.
That's right. And we're drawing this information strictly from excerpts of a text we're just referring to as pasted text.
And our goal really is to understand a pretty significant claim made in this text. It's attributed to a medical expert.
Exactly. We want to get into this assertion, this claim that President Biden is battling a very aggressive form of prostate cancer.
And not just that, but that it has spread to his bones. That's bone metastasis, medically speaking.
Right. So our mission today is basically to unpack what this claim involves, what it suggests, and, consider what it might mean.
But critically, based only on what's in this pasted text.
Absolutely. So let's start with that headline claim. Biden battling most aggressive type of prostate cancer with bone metastasis, medical expert says.
Okay, most aggressive type. What does that generally imply in medical terms?
Usually aggressive points towards a cancer that grows quickly. It can often be, more challenging to manage or treat effectively.
Right. And the bone metastasis mentioned, we know metastasis means the cancer is spread, but is there something particularly concerning about bone metastasis?
Well, yes. If we're looking at the bigger picture, bone metastasis means the cancer cells have traveled probably through the bloodstream, and they've started forming new tumors in the bones.
Okay.
And that can cause, significant pain for one. It also increases the risk of fractures, bone breaks, and it often signals that the disease is in a more advanced stage.
I see. Now, here's where it gets, interesting contextually. This info is presented as coming from a medical expert.
Right.
What kind of weight does that attribution usually carry, at least when you first encounter a claim like this?
Well, attributing it to a medical expert, it suggests this isn't just, random speculation. It implies there's some professional assessment behind it, a certain level of knowledge or authority, at least as presented in this pasted text.
Right. So if we just take this pasted text at face value for our analysis, we're looking at a statement from a medical expert saying President Biden has a fast-growing prostate cancer, potentially hard to manage, and it's already spread to his bones.
Precisely. That's the claim presented, and it's obviously a serious one, significant potential implications.
Yeah.
But, and this is crucial, our exploration here is confined to this single source, this pasted text.
We're not bringing in outside info or trying to verify the expert's statement ourselves.
Exactly. We're just analyzing the claim as presented.
And that's really what you, the listener, should keep front of mind. We're examining this specific piece of information, these specific claims, just as they appear here.
What's perhaps notable is the level of detail in the claim. It doesn't just say cancer, it specifies an aggressive type and bone metastasis. That specificity, supposedly coming from a medical expert, does make this particular piece of information, stand out a bit.
Okay, right. So let's just pull it together then. To summarize the core claim from our source,
yes,
based entirely on the pasted text, a medical expert is quoted. And this expert asserts President Biden is battling a very aggressive form of prostate cancer.
And crucially, that it has spread to his bones, bone metastasis. That's the essence of the information we've analyzed from this specific text.
It's a stark claim, as you said.
Okay.
And attributed to a medical professional within this source.
Correct.
Okay. And, that really leads us to our final thought for you, the listener. Maybe reflect on the role that expert opinions play, especially when they're reported like this in the media. How do they shape our understanding of complex health information, particularly when it involves public figures?
Yeah, and maybe consider what further questions information like this presented this way raises for you. Questions about, say, health transparency, or how these narratives circulate in public discussion.
Some things to think about. Thanks for joining us for this deep dive.